I wanna all night. Say it. I wanna all night.
Hello, stranger. It's been a minute.
Yeah, dear YouTube, welcome back to my channel. If you are new, my name is MelisaMarie. Thank you so much for stopping by to watch a video. I post videos about nursing, lifestyle, and all things Jamaica. This video, I'm going to be giving you an update on my career thus far. I am a neonatal ICU nurse, and I am at my 8 to 9 month mark since I started, so I'm technically very much a new grad. The question is, do I truly love my specialty? And the answer is yeah. I genuinely love being in the NICU. There's a lot of good things about it that I could talk to you guys about, and there's a few things that are not so good, but for the most part, I really cannot complain. I feel blessed that I'm even in this specialty as a new grad, because it's very hard to get a NICU job as a new grad. Hence why we moved to Maryland instead of staying somewhere else where we were, like Atlanta or Philly or somewhere where we had a connection. We had to move somewhere completely different because everywhere else was like, oh, did you do a practicum, and what experience do you have in the NICU? And it's like, girl, I don't have no experience. I'm a new grad. Like, come on. So a little bit of background about me. I graduated from nursing school last summer. I started pretty much right away. I took my NCLEX like within a week of graduating or something like that, and then passed and all that stuff. And I was just kind of like really quick with it. I got the ball rolling because I just didn't want to wait, and also money. So yeah, I started pretty quickly, and I started right away in this level 4 NICU, which I am in. And PSA, by the way, because I was talking to someone the other day who didn't understand this concept, but just because your hospital is a level 1 trauma center does not mean that your NICU is the top level as well. The numbers as far as rating goes for acuity is reversed. So a level 1 trauma center is the highest you can go as far as it happened. You had an accident and you were dying, you would want to be at a level 1 trauma center. However, if your baby was very much sick, being in a level 1 NICU would probably kill them. It's not really even a NICU. Like a level 1 NICU is basically like a well baby nursery, which means there's nothing wrong with your baby. The nurses there are not ICU trained. They don't understand certain concepts. They generally probably don't even take babies under like 35, 36 weeks, you know, no respiratory support, none of that. So in the NICU world, it's reversed. So it's actually level 4, which is the top level, and then level 3, which is like, okay, level 2, which is like, all right, no, level 1, right? So I'm in a level 4 NICU, and I love that. For me, I'm very grateful to be in a level 4 NICU as a new grad, because I'm seeing so much. I'm seeing so much. I'm getting tons of experience. I feel like my foundation is firm. I feel like it's becoming very firm. I'm very comfortable with a lot of different skill sets that have to happen being in a level 4 versus if I was in like a 3 or a 2. So I'm very happy with where I am. I will say that I feel like my unit specifically is very supportive, genuinely. And I feel like that's hard to come by these days, especially with the nursing shortage, because everybody's stressed, everybody's short-staffed, everybody's like focused on just like the numbers of it all, right? Like filling positions. But I feel like my unit also does go above and beyond as far as trying to create like a community atmosphere. Even if it's not successful, I feel like they try to create like a community atmosphere to foster learning in the new grads, and to keep us incorporated in a lot of things, decision making and stuff like that. So I cannot complain one bit about my hospital, my unit. Like I enjoy it so far. As far as the NICU itself goes, for those of you who are super new to my channel, you might not know that my first love was actually labor and delivery. And so for me, being in the NICU, I would say probably months like 4 to like 7, I was like back and forth in my head about if I should stay in the NICU. I was thinking like, well, after I meet a year, maybe I should spend like 6 months to a year in L&D, see if that's really where I want to be, because I was thinking like, I'm kind of missing that interaction with mom. But I don't feel that way anymore. I don't feel that way anymore. I feel good about where I am. I don't know if that's because initially I wasn't really getting a lot of parents who like were involved with their babies. Like we had like parents who were like on opioids or who live super far or something like that. Maybe they weren't like super present with the baby all the time. But now I get parents who are very involved all the time. They're always there. So with that, it's like, okay, I'm getting plenty of interaction with mom. I'm doing a lot of education just as I would in L&D, but more so my baby has the education part. That's where you're doing all the vaccines and smoking assessment and car seat, like that. I do that stuff with mom and baby. So I feel like I'm meeting my quota of interacting with adults as far as mom and dad, or mom and grandma, or mom and whoever their support person is. So I don't really feel like I'm missing that anymore now that I'm getting that more. I think I was maybe just a bit impatient to actually experience that, but yeah, it's good so far. I think NICU has to be like a long-term thing for me, just because there's just so many little benefits here and there. Like, I do love the babies. I love working with babies. I love the fact that they're tiny. Like, we get some tinies. Like, you know, we get some babies that be given this size. Like, this is a water bottle, but they be given this size. Like, they really do. We do have some tiny babies. And I love that for me, because I don't really have a lot of the concerns or issues that other nurses have, as far as back problems, as far as having huge messes. Like, some of my babies, they be having some blowouts as far as, you know, shit is concerned. They be having some big old poops, but it's nothing comparatively to my adult patients, right? So prior to the NICU, I worked in oncology and I worked in the emergency department, and in both places we had some shitty people, okay? Some shit explosions we've had. And I'm thinking, like, you know, like my oncology patients especially, because the chemo really forces that out of them. So I'm thinking, like, yeah, you had some poop up your back, up your neck. Like, you know, you also weigh 400 pounds, so change you. I needed a Hoyer lift, and I needed maybe another nurse assist to like roll you and put some Chuck's pads down and all of these things. And you know, it's a lot, right? It's exhausting in them ways. But in the NICU, we have some shit explosions where it's up your neck, but if you're the size of my water bottle, up your neck is not really the same surface area as somebody who's a full-grown adult, right? So those are like benefits, in my opinion, that I feel like, well, I really enjoy the fact that when they do have accidents, they're tiny accidents, you know? And I'm just like, oh, baby, you made an accident. Like, you boo-boo, it's okay. You can be really gentle with them and stuff like that. That's a benefit. Also, this is for ICUs in general. It's not just the NICU, like even adult ICUs. It's really less physical. And please comment down below if you disagree with me, if you work in an ICU. But I think that ICUs are a lot less physical. I think med-surg, emergency room, like those kind of specialties are like a lot more like actually physical on the body. But in an ICU, it's more mentally draining, because especially if you have a patient with multiple drips, with multiple running fluids, you have to remember like so many moving parts. Like, okay, is this medication compatible with this fluid? Should I pause this fluid? Should I, what speed should I run this over? And then when you're in the NICU, it's an added element of what's the weight of the baby, because if they're too big, too small, you could also probably kill them if you don't have the appropriate microdose to give them, you know what I mean? So there's a lot of mental moving parts, which I feel like is another reason that I really love it, because I'm somebody who needs my mental stroked. I need to have that mental challenge and push all the time, because I just really enjoy like the feeling of critical thinking. I enjoy that. That's really important to me, and that's only something you're going to really get in an ICU setting and like the emergency department. I keep bringing up the emergency department because in my head that's a place that it should be considered critical care, even though it's not. For the most part, they get patients that are like, oh, my cat bit me, but you can also get patients who are very sick. Like, you get ICU patients in the emergency department, then they get transferred to us. Those kind of positions, I really think that the critical thinking element is really important, and it's really nice for people who really love that. The more that I'm working, the more that I'm, you know, learning and realizing that there are certain disease processes that happen all the time, such as HIE, which is hepatic or encephalopathy. I don't know, HIE. I'm gonna put it in on the screen what HIE stands for, but like in those kind of babies, you enact cooling, which we actually cooled babies for a period of 3 days, and then we rewarm them afterwards. The idea is to kind of give their brain a rest as it has like an injury, and then it can like heal itself. And you know, especially at that age, your brain is super elastic. You know, we have the babies who clamp down. Like if you have a clamp down type of baby, they basically don't like to breathe. And I know the PICU gets this a lot as well, because they have the kids who kind of do the same thing, where it's almost like a like a pit bull, how they have a lock jaw. The babies will do that too. And so when you're trying to suction, trying to use PPV or blow-by on them to get them to breathe, it's not going in because they are literally clamped down. Like there's no way you can get any air or forced perfusion in there. So, and then they turn blue, like as blue as my scrub top. They turn blue. Yeah, so I see those scenarios all the time. So I'm, you know, starting to get very comfortable with like what to do if I do see that and how to save the baby. It's really nothing. It only becomes difficult when there's a parent in the room. If there's a parent in the room, obviously, you know, they're seeing their baby go from, you know, pink to blue and they are freaking out. Yeah, so that's really the main thing with that. You know, we have blood sugar problems, which usually happens in the bigger babies, like if they're closer to their gestational full term date. We have the tinies, like 24, 25 weekers, 500, 600, 700 grams. I love a tiny baby. I really love me a little micro preemie. The more translucent, the better. If I can see through your little skin and see your little veins, I just love that for me. I really do. I mean, they are super critical, and that's, you know, the reason why I'm in the ICU in the first place. I love a critical baby. We do get a lot of babies that don't even belong in my level 4 NICU. They should be in well baby nursery. They just don't know how to deal with them. So like, for example, like there's been shifts where I just had feeder growers, which if I say feeder grower, I mean like the baby is literally fine. They're just getting bigger, they're growing, they're eating and they're growing. They're under the threshold for being in the regular nursery. Less than 1,800 grams, I believe it is, or less than I think it's 1,800 grams. You know, they're tiny. The idea and the priority is to make sure they just develop their suck, swallow, and breathe mechanism and learn how to feed, latch on, and stuff like that. Because we do get babies who don't understand the idea of suck, swallow, breathe, and so they choose. So they either suck and don't breathe, or breathe and then don't suck. But the suck and don't breathe part is like, okay, well then you turn blue because you're not breathing. You're sucking the bottle, but then you're not breathing, and yeah. So then that requires, you know, baby to have some time with speech, OT, PT, and stuff like that to try and develop that. Not really PT, but speech and OT. I do love it. I do love it. I love it. I love it. There are some nurses on my unit specifically who are a bit of bullies. I was gonna do like a whole formal like Q&A thing update, because people were asking me like, how is it in the hospital? Are nurses still eating their young and all that kind of stuff? And the answer is yes. Yeah, nurses, like I hate that this is a part of the profession and something that is really carried on through generations, but nurses genuinely do eat their young, and it's really upsetting because it could be so much further internally as a profession if we provided other means with communicating with our new people. And because of the fact that I've experienced like a specific there's like been 2 specific incidents that I've experienced with nurses who are just mean people, and especially in the NICU, it's very difficult for me to understand how someone who is mean-spirited has ended up in the NICU. You kind of have to have like a sweet personality underneath it all. Like, you know, I could be hard or whatever, you know, I could be for the streets, but at the end of the day, under it all, I'm like a sweet person. My husband was telling me this yesterday because we went out to a party and I was telling him, you know, I could be hard, and I'm smiling as I'm telling him this, and he looked at me and he was like, would I never believe you would have bush shot off of me? He doesn't believe that I would like threaten him and follow through, more or less, because I'm sitting there like, yeah, I'm a bad girl, I'm a bad yell, like, you know, I'm talking to him like this and literally smiling. All that to say, I don't understand how some people are so miserable and angry in the NICU, because you didn't have to choose this life. You literally could be in the emergency room and like an adult. It's somewhere else where people are typically really aggressive and really like hardcore. You could literally be there, but you chose to be in the NICU. Like, why are you mad, bro? And I've interacted with those nurses, and it's very difficult for me because on the one hand, I really want to be forgiving and kind, and you know, I want to like have a good reputation with the people in my unit. If that's important to me, just anywhere I work, I like to have a good reputation. But at the same time, you're not gonna try me that many, like you're not gonna try me but once. You can try me one time and I'll let you go, but more after the one time, you're getting cursed out, and that's just what it is. you know. I wish that I was better. I wish that I was healed in those ways, but I am not. For this one particular nurse who was really like coming at me, she blamed me for a situation that was not my fault, not even my patient actually. She got cursed out because why are you talking to me like that? Like, who do you think you are? I know that at the end of the day, I need her more than she needs me, because like if I have a question about something, I'm gonna ask, and you know, I need that support. So I don't know if I was just being like really timid at the time and not fully asserting myself. You know, you can't really curse somebody out with a smile. It don't work. So I don't think she took me seriously, but we have since not really interacted like at all. I don't talk to her at all. Even if I see her, I don't talk to her. I literally will go out of my way to like go ask somebody else for help if I have to. And I do want to say, like, for those who've experienced like bullying in the workforce, especially in the nursing field, it is okay. It's not you. Don't blame yourself. It had me some shifts like sitting here second guessing, like, damn, am I a dummy? Like, do I know anything at all? Am I grasping anything? And then I realized, like, no, girl, you know a lot. Like, you know quite a bit. Like, you know what you know, and don't question that. You know, I had to like really like talk myself up to the point where I understood, like, nah, it's her. She woke up on the wrong side of the bed. That's my experience with like bullying a little bit, but I'm gonna make a whole separate video on that. I just wanted to like put that in because that is a part of my update. That's important. The other thing about the NICU that I don't necessarily love is like the nail situation. So you can't wear nails in the NICU, and that's just like infection prevention purposes, right? You can't have like acrylic, you can't have gel, you can't have tips, none of that. It has to be like your natural nails and or natural polish, which means if you're getting natural polish, you gotta really get your nails done like every week, sometimes more than once a week, because it chips so easily. So that's something that I really don't love, and it's another reason, I know that sounds superficial, but it's another reason why I consider it like maybe the NICU is not for me, because I need my nails done. I cannot exist without my nails being done. We have since adapted. We've had bigger and better priorities, right, versus your nails being done. But that is one thing. Same with like my ring. Like, you know, I enjoy wearing my ring. I am a newlywed still. I got married the same time since I've been working, basically. So like basically like 8 months I've been married now, which is crazy. That's crazy. Shoot. But I can't wear my ring because infection prevention. It's bare below the elbow, right? So around my Apple Watch, I don't really get my steps recorded accurately because I can't wear it. So stuff like that really kind of makes me like annoyed, but in the grand scheme of the career, can you really complain about stuff like that? Like, not really. Like, I'm in a career that in a specialty that I love. So if I can't wear my ring or have nails or my Apple Watch, that's really the least of it all, where people are really unhappy in their nursing career and really burnt out and stuff like that. So, you know, but that's just something also to mention. Yeah, so just transitioning now onto like future things, what I plan to do with myself and in this career. So I am actually in the process right now of applying to grad schools, and this is something that has been very controversial. I've sought advice and mentorship from many people who are in the next level above me. So whether they are an advanced practice provider, such as a neonatal nurse practitioner, a certified nurse midwife, or even students like NMP students, nurse midwifery students. I've sought mentorship from PAs, physician assistants, also from from medical doctors, and from fellows. Definitely the fellows. I talk to the fellows a lot. I have gotten a lot of mixed information. For the most part, a lot of like the nurse practitioners that I talk to, a lot of them more so discourage me from thinking about school at this point. And I know I'm gonna get it in the comments, so you make sure you comment down below what you think as well. I appreciate all of the general advice and stuff like that, but at the end of the day, I'm gonna make the decision that I want to make for myself, what I feel like is best, what I feel comfortable with, what I feel firm about, you know what I mean? So yeah, I've gotten a lot of pushback from some nurse practitioners who basically say like, you trying to go to school with having just 1 year of experience is ridiculous. You don't have any kind of foundation. You don't even understand X, Y, and Z, yada, 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 yada. And it can be discouraging because obviously they know better, right? And, you know, at the very baseline, they've experienced things. They've had 10, 15, 20, upwards of, 30 years sometimes experience in the NICU as a bedside nurse. ironically, as you change from the nursing side to the more medical model, so like my PAs who are trained under the medical model, not the nursing model, and my doctors, my fellows especially, they fully support me. And they're the ones writing my recommendations, but they fully support it. And their reasoning is more so like, yes, having the bedside experience is important. However, the role of a bedside nurse versus the role of a provider are two very different lanes. And they've expressed more or less like, no amount of bedside experience is really going to train you to be a provider. It's going to help you as far as recognizing clinical symptoms in a patient, or maybe like if a patient is about to have a swift decline, like maybe you could recognize that. Or a baby's like honeymooning, for example. We call it honeymooning when the baby is doing really, really good for like a week or two and then they crash, which happens a lot. You recognize clinical situations better because you've been at the bedside and you've experienced it. But at the end of the day, as far as management goes, like my unit, for example, was 52 beds. If you are a provider, you might be one provider, especially on nights, you might be one provider for like 20 patients, right? 25 patients. So imagine you learning how to juggle and clinically manage all of these patients at the same time versus as a nurse where you can have 1, 2, sometimes 3 patients. So you're only really having to think about 3 patients at a time. You're not really thinking about the big picture of everything. So it's not to talk down on nursing. It's very important, especially in an ICU, in a critical care setting. It's very important, but it's different. And that's why I'm very, very glad that I did seek out these mentorships and education with these providers who are not from the nursing side, because they provide a outlook that is very different, right? Where it's basically like, you having this advanced pathophysiology and having this advanced knowledge, you're going to apply it very differently than you did before. And you're going to have to consider things very differently than you did before. All of that to say, I'm applying to school actively as we speak, guys. I do have 2 top choices that I won't reveal as of yet, but I will tell you that the specialty that I am applying for is neonatal. I'm applying for NNP school. I think my previous video I was saying like, maybe I'll do midwifery, like but I'm gonna do NNP school. I think it's the best thing that I could do. And I'm also looking at programs that are very long, because we have some programs that are like a year, like literally you can be an NNP in a year. I think that is ridiculous for me as a new grad. I feel like a lot of the programs I'm looking at are like basically like a 5-year type of thing. It'd be like part-time, like maybe full-time 3 years, part-time 5 years. At the end of the day, I would like to have a baseline of 5 years of nursing experience. So if I did a 5-year program right now, then I would have 6 years, right? At the end of that. So I do want to have like a good 4 to 5 years of experience when I graduate. It just makes sense to me. I feel like I have a foundation that I'm very comfortable with right now. I definitely have so much more to learn. I'm not saying, oh yeah, girl, I know everything. Hell no. I have so much more to learn, but I feel like I'm in a good place where I'm comfortable with a lot, and I'm also always seeking out more. I'm always in those fellows' faces asking them questions. Like, they'll give me an order and I'll literally be like, but why? But why? Why would you do that? Not in like a rude way, but just like, because I want to understand, and I'm in a place where, just getting orders and just performing what they're telling me is not really okay anymore. Initially it's okay because you're still trying to understand the flow of things. You're still trying to just get into a routine. But at this point, it's like, well, I kind of feel like, maybe this intervention would be better, or maybe we should try this thing. It's just really just follow orders. That's not to say you can't advocate for your patients. Always advocate for your patients. Yeah, I'm applying to school right now. I'm very excited to be taking this next step. So, obviously we're going to have more videos that come up as far as the grad school transition and how that goes for me. More specific videos about the NICU and how that has gone, where I'm still learning and seeing new things and stuff like that. As far as school is concerned, if I were to have waited like the 5 years before and then apply then, I feel like I would be really sad. Even some schools, like one school that I really am interested in, fall 23 admission cycle is full. So I couldn't even start at my 1 year mark if I wanted to. It would have to be at 2.5 years, because they're currently accepting students for January 2025, and we're in summer 2023. they're accepting for January 2025, which will put me at 2.5 years at that point, which that's even fine comparatively to a lot of other programs. But because I don't mind like having that 2.5 year experience before starting, but waiting 5, 6, 7, 10 years before starting is an absolutely no. And that's what a lot of the nurse practitioners were telling me I should do, is like wait for that. And I don't agree with that at all. Why don't you guys comment down below, tell me what you think about timeline for starting grad school, and if you feel like it's appropriate to like start right away. I do have some people actually on my unit even, and other people who I've talked to, who literally have like went right away. Like they graduated with their BSN and then started their MSN or DMP like literally the next month. That's not something that I would do either, because for me personally, I just want to make sure that I'm not half-assing anything. I just want to make sure I'm pouring appropriately into each lane. So like after getting my BSN, I had to focus on my NCLEX. I had to focus on moving. I'm in a new environment. Like I want to see things. I had to focus on this new specialty that I don't know. Oh, I'm popular. And also like, you know, a lot of these programs as well, like just the way they're set up, they are like starting to be more on the medical model of things. So in the nursing world, for those who are in nursing school, you understand, as the nursing world goes, you do your didactic courses and your clinical courses together. So say you have like med surg, for example, or adult health if you are at Chamberlain, then at the same time you would also have clinical for that class. So you would have a test in the class and then you would have clinical in the same time period. Versus in the medical world, your first 2 years are just didactic. So you're literally only focusing on exams, quizzes, getting that foundational education down. And then the last 2 years are you actually being in the clinical setting and applying those things in person. And I love that. I prefer that model actually. And it's the reason why I consider maybe I should do PA school instead. I considered that for a bit. There's actually some nursing programs now that we're like getting into this DMP world. There's some nursing programs now where they are doing that model where your first year to 2 years are strictly didactic. Some of them strictly online, where it's like, you know, you're doing your advanced pathophysiology, your advanced pharmacology, your neonatal assessment. You're doing all that stuff strictly online in that 1 to 2 year mark where you can focus on that. And then you do courses where you are in the hospital getting those hours in. I do love that. I feel like that is a much better model, much better for students to be able to learn and not have to like juggle so much, because I'm planning to work through this, you know. It's just because I want to continue to gain experience. But anyway, that was just a quick rundown, guys. That's like a quick rundown of what my life has been like. The last thing to update on is obviously Maryland, right? I've been in Maryland for the same amount of time, right? The 8 to 9 months. And it's okay. I don't love it, to be honest. I love closer to the DC side, but otherwise, like, I feel like I'm in Philly a lot. I'm honestly always driving, or New York. I'm driving to Philly or New York. If you want to get like some Spanish culture or some Jamaican culture even, you really have to kind of drive for like 30 minutes in whatever direction into whatever suburb to really get it. And I don't really love that about the city. The food is disgusting. I've said this. I feel like I say this every video. The food is so nasty here, and it's such a big deal because my husband's a chef, so like basically my palate is elevated, period. But the food is nasty, and I'm like, yo, how a whole city is sitting here surviving off of this nasty food? That's crazy. Like, anybody reported this? Like, I'm gonna report y'all to the FDA. So I don't know if I'm gonna stay here long term. The answer is probably no. I do know I'm not staying here long term, but for now we're here, we're getting experience. I do love my hospital. As far as traveling goes, I'm still considering traveling. It's not my priority anymore like it was, because I'm more thinking about becoming an advanced practice provider. So I'm more interested in making sure that that gets secured. But like I just explained to you, if I am in a program where we're having those 1 to 2 years that it's just strictly online and it's didactic, then yeah, maybe I could travel in that time, really gain some experience that way. But with traveling, I feel like the amount of experience you need for traveling is a little bit different versus versus like going back to school, because with traveling, you are really usually thrown into the fire, and that's your license on the line. You don't want to not be fully ready for that, versus with like school, it's like, it's more or less, are you able to mentally juggle all of this? With traveling, you gotta physically and mentally, but physically be ready to say, okay, I can handle this assignment. I can handle this. Like, as a traveler, there's no assignment you should get that you should be able to question and be like, I don't know if I can do that. Like, anything they give you when you walk into a facility, you should be able to be like, yeah, I got it. And what? And what? You know? That's how you should be as a traveler, in my opinion. Not to say you can't ask questions. Always ask questions. I'm a big proponent. Always ask questions. But you should be very well prepared. So yeah, traveling may still be a thing. Who knows? Who knows? But for now, I'm pretty good with where I am, what's going on. And for anybody who's still in school, just do not stop. You were almost there, guys. Keep pushing. And I hope you guys join the best specialty ever, which is the NICU. And yeah, if you have any questions, make sure you comment down below. Like, share, and subscribe. Follow me on Instagram. I'll post it here just so you see it. And yeah, I'll see you guys in my next video. Look more.
Just say you will come through and chill.